the timing becomes important. Do it on the recommendation of a physician. I've seen a lot of patients, sir, we had the symptom, we started steroid. No, don't do that. Right from first day of your first symptom to about 3 or 4 days, the virus is still multiplying. Though it is being attacked by the antibodies, it is still multiplying. And this multiplication phase will be prolonged. Your disease will be prolonged if you start steroids early on. Don't do that mistake. You're actually harming your body by preventing the body from eliminating the viruses. Don't do that. So therefore, timing becomes critical of not starting steroids in the first 5 days of the disease. Once that viremia phase, as it is called, is over and the autoantibody reaction is starting, that is the stage to start steroids. So 5th, 6th day is the usual time when it happens. Recognize those who do not have any symptoms of the second stage, do not worry. Those that have, you start the steroids. Combine it with anticoagulants. Steroids are not to be taken lightly. Anticoagulants are not to be taken lightly. So do not do this on your own. Do it on the recommendation of a physician. Now you'll ask me, what is danger about steroids? The timing becomes important. Supposing you give steroids early on. I've seen a lot of patients, sir, we had the symptom, we started steroid. No, don't do that. Don't do it on your own. Despite your steroid, you do have clotting in your veins, and that has to be prevented by anticoagulants. A lot of people think they can manage with aspirin. Please remember, it doesn't work. To the best of my readings that I have found, it doesn't work. Why? Because the infection of the virus itself, if you look at the platelet count of the blood count of these patients, they'll find platelets are always low. 40,000, 30,000, some with 25,000. Does that work to prevent clotting? No, they still have clotting. Therefore, merely giving aspirin doesn't work. You have to give anticoagulants, and these have to be continued for 3 weeks. Why 3 weeks? Why not 10 days like steroids? Because the tendency for clotting remains for about 2 to 3 weeks. Therefore, you cover up for 3 weeks. You would have managed the storm from happening, managed the worsening of the disease, and most patients have a good outcome.